Welcome to LINNC 2024. My name is Igor Pagiola, I'm from Brazil, and now we're going to interview Professor Aymeric Rouchaud that works in Limoges about a very interesting object. Aymeric, welcome to this interview.
Hi, thank you, Igor.
So the first important point, we saw in your presentation that there is a new device that maybe will help us to understand the clot. What is this new device?
Sure. This device is the Clotild Smart Guidewire. This is a standard 014 guidewire which is equipped with the very breaking new technology, which is an impedance sensor which is able to characterize the clot in situ. So when we have an occlusion of the M1 artery, for example, we usually don't know what is here. Is it red blood cells rich clot? Is it a platelet rich clot? Will we be easy to retrieve or not? Will we use stent retriever or aspirations or maybe both techniques together? And usually, for the moment, it's not possible to have the descriptions of this clot. Here, with the Clotild Smart Guidewire, we can have in situ characterizations of the clot, and it will help us to have this technology and help us to have the best technique for thrombectomy. So we will know the enemy before going for the war.
Amazing point. So you can understand the clot before doing this thrombectomy. And regarding the technical point, there are some difference to use this clotted guide wire, or is the same technique as usual?
This is exactly the same. In fact, the sensor is 2 millimeters, which is implanted at the very distal part of the 014 guide wire. So you use the 014 guide wire, you cross the clot with the sensor, and there is a transmitter which is connected with a tablet, which is called the Clovis tablet, and we have live analysis of the clot. So in the angiosuite, this is exactly the same as the standard routine, so very easy to use. And we just ran the CLOT OUT study, which is a first-in-man study. The main endpoint of this study was to analyze the safety of the guide, and we observed no complications with the guide, so very easy to use, safe, and high level of informations.
I think one of the most important results that we saw in your presentation about the CLOT OUT study is there was no dissection or perforation with the guide. And another important point, which are the next steps to use the clot wire?
What we observed there in this first study, it was the huge correlations between the impedance analysis. So this was in 38 patients. We had this huge correlation with histology. So we can see that the histology fits very well with the impedance spectrum. And based on this, then we will make another study to have the correlation between the techniques used for the thrombectomy and the outcome of the patients, and also based on the impedance to see if the type of clots with in situ analysis can help the results of the thrombectomy. So this will be the next study for efficiency of the use of Clotild.
Amazing. I think that this is a new window that opened for interventional radiology. As Professor Moha said, I think that you can see the histology without taking a piece of the patient. So this is amazing, and we can understand better our enemy, that is the clot, during the thrombectomy. Thank you very much, Aymeric, to be here with us.
Thank you very much, Igor. Thank you.